Good evening, my dear friends. Myself, Dr. Joseph Casey. Today, I am going to speak regarding stroke. So, what do you mean by stroke exactly? So, you find that some part of the brain damaged and nerve tissues getting damaged so that you lose the control on the contralateral side. If there is a stroke over here, you lose the ability to work in the right hand and right leg. See what is happening here in the sense. So whenever the blood walls break up, so there is a direct hit on pressure onto the nervous tissue where it starts degenerating and starts sinking up. So has the brain which is controlling the hand. What happens? Slowly the governing body of the hand starts slowly loosening up, slowly degenerating. In the same way the hands going sink. Day by day you can see the tightening of the hand will take place. Initially it will be in a flaccid stage, no movement, but later on as the days goes on it will be striking stage and it will come lock. So however you want to extend, it will be very forcefully you have to extend. Suddenly it will, just like a spring, it will pull back. So most probably this stage will be attained day by day. So what are the mistakes we do in treating stroke? So first of all, we apply the oil and give massage and all. That should not be done in a initial stage. That is an acute stage, because the tissues damaged over here really are the nerves. These are controlling the governing muscles. So you should not extend, release and give a severe and vigorous exercise, because by doing serious and vigorous exercise and massage, what will happen? Further spasticity will occur, because it is governed by the nerves of the brain. And if you start controlling and exercising it, it starts the spasticity. So now what we have to do is that first thing what we have to do is that reduce the cerebrovascular damage, control the BP, stop the bleeding. Okay, and later on what we have to do means activation by acupuncture. It's very much essential thing. See, when you activate one muscles over here with a minimal invasive technique, your hand starts vibrating in this way. So this gives a sense that there will be activation of the same controlling brain cells. See, if you are going to see the functional MRI, I don't think many of the centers will have the functional MRI. Functional MRI means as the patient moves the hand, so by the radioisotopes which you have pushed into your body, the part which controls the hand start blinking up. Getting the point? So so we can understand which part of the body is being controlled by which part of the brain cells. So this is called as functional MRI. So when you have small vibration, when you give an acupuncture, what will happen? This part will give a negative feedback mechanism to regeneration of the nervous tissues. If you keep on massaging or doing some exercise, so muscles get hardened up, because it is not under your control. It's under the control of brain, where it lost its control, and you keep on further giving exercise and manipulating it, it get hardened up, struck up. So the best thing that we have to do is that emergency, stop the bleeding, lower the BP and rush on to the acupuncturist first thing, where we can do the brain mapping technique to regenerate the nervous tissues. So a same amount of the electricity that brain has liberated to control its muscles, what you have to do means you have to give in a small frequency of megahertz, where brain cells get activated from here to here. A sense of stimulation will be occurring. First thing is that. And second thing, most of the people will have cervical spondylosis due to their posture of losing half part of the body, and usually the other part will gain the strength and pull out the disc or pull out the there will be decurvature or scoliosis or lordosis or kyphosis of the spinal cord, by which the conduction of nerves which is there from which is coming from our brachial plexus and lumbar plexus getting constructed. So however you give on acupuncture, the conduction will not be attained. Only for the short duration this movement will be attained, and immediately after you stop the stimulation, the process will be stopped. So now what you have to do, by the technique of Tron, you have to fix the nerves. If there is scoliosis, kyphosis, whatever the thing, fix it into a proper S-shaped curvature, and now you give stimulation. And one more thing is that if you give ozone therapy into ear, what is ozone? O3. So that is which can boost the tissue level oxygen. So definitely you know that when there is a compression, when there is an hemorrhage, if you give the ozone, it will oxidize the dead cells. That is, the cerebrovascular pressure will be lowered. First thing. Second thing, the tissue which was deprived of oxygen, you will get oxygenated. So cells will not destroy completely. So if you give ozone therapy into your ears, so the possibility of the further complication is being resolved. So one of the patient, she had taken to me in an unconscious stage. So after giving ozone, brain mapping, and also one leech therapy, and I have to tell about leech. So what is the benefit of leech? Make small punctures in needle. So if it is affected over here, same side, just puncture with the needle and put one leech, jalauka. What it will do means, as it sucks blood, it pushes hirudin into the blood, so that whatever the cerebrovascular pressure was there, that could be reduced. So that is a very beautiful technique, and you can see in an emergency condition where there is a severe hemorrhage, so these surgeons make a small keyhole surgery to drain out the excessive blood clot over there. So that the same thing, in the same manner, if you are able to do with the leech, definitely that could be of a great help to the patient. That is a non-invasive blood letting process. So it helped a very many patients. So I have treated one coma patient where he was like told like he will not leave. He was just sent back, let him leave or die. Now we cannot do anything. So he was just 21 years. So patient's party approached me, sir, what we can do? I told them, yes, give me 15 days of time, let me try. So on the 13th day, however I tried, the patient was not retrieved. They used to carry the 21 years old guy just like a small baby, and they used to go. On the 13th day, I failed in all the techniques. Then what I have done? I had done a leech therapy. To be frank, the next day itself, the patient was miraculously able to come into a consciousness, and he started with the movement of the limbs and all. So later on, I just picked up, and the patient which we thought he will not survive, he survived. He is able to speak now, walk now, everything is possible. That is really amazing of leech therapy. And I was supposed to tell one more beautiful thing is that, so before treating any patient, give confidence such that because their manas only has the ability to cure any disease. This is the first thing you have to do, that whatever, if they are depressed, if they are thinking about their disease will not get cured. So ask the patient, forget of the disease, think of yourself. You should be in a state of happiness. So I do not know how you counsel them. It's an art of counseling. How you can make that Satva, avajaya, chikitsa. That's a bigger topic where I can explain some other time, or you can come over here to learn all those things. And if you make that, definitely the treatment works and we'll get a good result. Thank you and watching my video. Have a good day. Bye. ಆಯ್ತು, ಮಲಗಿಸಿ. ವೆರಿ ಗುಡ್. ವೆರಿ ಗುಡ್, ಸೂಪರ್. ಸೊಂಟಕ್ಕೆ ಒಂಚೂರು ಬಲ ಬರಬೇಕು ಅಲ್ವಾ, ಹಂಗಂತ